Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about getting the most out of your doctor's appointments. Let's get to some of our viewer questions. Ryan from Santa Rita asks, how much does my family history play in my health, and how much of it should I know during my doctor's appointment?
Sometimes it's very important, especially on the island. If you have diabetes or high blood pressure, it's important for us to know about it. Certain cancers run in the family a little bit, especially colon and breast cancer in the immediate family. I think just at least some idea of what's going on in your family is very helpful. Although each of us is an individual, and the way our genetics play out doesn't always match with our family.
Okay, John from Mighty asks, when do I know if I need to see my regular doctor or go to a specialist?
Great question. Most of the time your regular doctor can help, and you may even call their office and say, I have this such and such problem. Do you think the doctor can help with that? If not, can I get a referral? And I get those questions frequently. Sometimes it's really obvious that you need to see a specialist, for example, if you've broken a bone. But in general, your family doctor can help you first to point you in the right direction.
Okay. Lonnie from Dededo asks, my kids get sick regularly. Is it okay to share their medicines?
Yeah, that's a tough one. I guess in the case of asthma, if you have several children who suffer from asthma, you could use their inhaler or their albuterol medication nebulizer. You know what you're doing there, but generally I'd say certainly for antibiotics or those kind of things, you really wouldn't want to be sharing those between the kids, because you'll be diluting the dosages down, and it's going to be hard. Most people do that because they're trying to save money or just don't have the time for their doctor's visit. I try not to do that.
And plus, we've mentioned before that antibiotics, you need to take it for the full course.
You really do. You really do. And each child is different. Although they're all in the same family, they may not have the same exact thing going on, and so treat them as individuals.
Okay. Sheila from Enarahan asks, how important is researching new medicines, treatments, etc. before my appointment?
Right. It's a great question. You know, some people come in knowing more than me about their health problem, which is great. But I think you can rely on your physician to give you the best information that they're aware of. Sometimes there's a lot on the internet that is sort of confusing or misleading. But if you have a very specific health problem, it can certainly help you to look up alternatives on the internet. And there's always new things coming out, so your doctor may not know everything either. Yeah.
But then again, you guys are also the ones that have gone 2 years of schooling and do know best.
Yes, well, we can help you hopefully evaluate what you've learned on the internet, whether that's appropriate or not in your situation.
Okay. Vince from Jigo asks, I'm going to be getting surgery in the next month. What types of questions should I ask my doctor? I'm assuming they would be different than the usual.
Yes, they would be. So what you want to know is, ask your surgeon, what do you expect? In the normal case, if you're taking out my gallbladder, you expect to have my operation last how long, and me be in the hospital how many days, and then be out of work for how long, and what level of pain will I have, and how will I have to handle my pain. So you want to know what is expected. Then you want to know the worst case scenario. What's the worst thing that could possibly happen? That's when the complications come out. Okay, you could get an infection, you could get bleeding, you could get this and that and the other. And you ask them, well, in your experience, what have you seen? How many complications have you had of this procedure? By the way, how many have you done in the last year? And your surgeon needs to be able to answer those questions for you, and you need to be satisfied. And they will be honest, and they will not be offended if you ask those questions. You're not coming at them with a negative approach. You're just finding out their level of expertise. And you can be very comfortable asking those questions. Then you also want to ask the best case scenario. In the best case, what will my outcome be? Well, you'll recover incredibly quickly, and you'll be out in a week, and this is what will happen. And how can I make that best case scenario happen? And that way you'll be best prepared for your operation. That might be things like controlling your blood pressure, getting your diabetes under control, or following a particular diet before your operation actually happens.
All right, definitely good advice there. And our last question comes from Louis from Barragata. How do I choose a family doctor, and what should I look for?
Well, there are 4 things that people look for. One is affordability, another is availability, another is affability, how well you get along with them, and the 4th is ability, what is their skill level. And that sort of depends on what your health concerns are. You need to feel an attitude of cooperation with your physician, of trust, and of sharing similar values. You know, you may be somebody who really just wants medication for everything, or your doctor may be that kind of physician, and it needs to match so that you're both on the same pathway and that you feel comfortable working together for your best health.
Okay, so the 4 A's: affordability, availability, affability,
And ability.
ability. The 4 A's. Any last words of advice that you like to leave with our viewers on how to get the most out of their doctor's appointments?
I think a very simple thing would be when you're coming into the doctor's appointment, 2 small things. One, if you're coming for your physical, come fasting so that you'll be prepared to do a blood test if necessary. That will save you time. Bring your blood results and test results with you if you've had any done and it's a follow-up appointment. That will save us time. And then another thing would be just put away your cell phone, because you know, when you're in the room and you're taking calls while your physician's trying to talk to you, it's really quite distracting. So,
good to know.
Yeah.
Good to know. So keep those phones in the car or in your purse.
Somewhere.
All right. And thanks, Doc, again for coming in. And remember to prepare a list of questions and concerns before your appointment. Not too many, just a couple. Be honest and don't be afraid to say that you don't understand. Remember that informed patients make better health decisions for themselves as well as their families.